Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins. We have a quorum.
Senator Blunt, have you had a chance to look at the Pharmacy Practice Act? If you're ready to do the Pharmacy Practice Act, I will recognize you to move title sufficient to pass and tell us what we're doing and why.
We have a strike all amendment. Mr. Chairman, I'd like, if I'm recognized, I can explain it.
You are recognized.
Thank you. This bill comes to us from the Board of Pharmacy. They need to get their repealer extended so they can continue to do the work that they do. They do have, and this of course is the reason we have repealers, they do have a few technical changes to current law. First, I'll say that the strike amendment extends the repealer on the board to 2029. The strike amendment adds a new definition for an entity called Pharmacy Service Administrative Organizations. I want to be real clear, this doesn't have anything to do with PBMs. The strike amendment does not affect what the legislature may or might not do with regard to PBMs, but pharmacy service administrative organizations are entities that are engaged by pharmacists to work with PBMs. The bill would create a new definition so that they are regulated just like everybody else by the Board of Pharmacy. It also would require make some changes to the to allow that the executive director to carry out some functions that are currently only can be carried out when the board meets in person. That slows down the service that they can provide. It does not allow the director to make disciplinary actions. Those actions will still be made by the board itself. And then there are entities and products that are not directly, that are sold by pharmacists that are not currently regulated by the board. These can include devices like a heart monitor or those machines, what are they called, to help you sleep at night, those things that require a prescription that are not currently covered and regulated by the board. I think those are the major changes, Mr. Chairman, but I'll be happy to yield for any questions.
So the bill that's in the package apparently is the bill that came from the House and not the strike all that I believe you were.
I've got, there's
okay.
a lot of stacks of paper, but I do have a copy of a strike all here of
Okay.
the bill
I found the strike all.
Yes, sir. The bill that passed the House did nothing other than extend the repealer, made no changes, no substantive changes to the law, but the strike all amendment does have some changes to the law that I tried to cover.
So we're on the strike all. The questions on the strike all for Senator Blunt. If not, Senator moves adoption of the strike all amendment on House Bill 856. All in favor say, Senator, yes.
I'm looking at the strike all on lines 331 through 337, and it gives a definition of pharmacy services administrative organization. Is that something that we currently have or we don't have? And who would they, it said they could contract with a pharmacy for pharmacy benefit managers, contracting with pharmacy benefit managers on behalf of pharmacies. So would they work for the pharmacies? Yeah, it looks like they would work for the pharmacies, I think.
Yes, Senator, that's exactly right. This is new. This is a new definition, and that's what they do. These are entities that are hired by the pharmacies to deal with the pharmacy benefit managers. So it's a middleman between them and the middleman. But that's something that the pharmacies can choose to do if they want to. And there have been instances where the board tries to request records from these entities request records in these transactions, and they can get records from the pharmacy, they can get records from the PBM, but they cannot get records from these the Pharmacy Services Administrative Organization. So they've requested this new definition for folks in this line of work.
So they currently exist. We're just basically defining who they are.
That's right. Yes, ma'am.
And they would be, a pharmacy would contract with them if they wanted to.
Yes,
So-
and they're doing that. Some of them
Yeah,
are doing it now.
Yeah, I'm just curious, like an independent pharmacist, would they be able to afford to do this? Or is this, I'm just concerned that hopefully that this wouldn't put them at any greater disadvantage.
It's entirely up to the nobody has to use these people.
Right.
If they choose to, that's entirely up to the pharmacist, and then it just means that that entity would be regulated just like the PBMs are regulated.
So the Board of Pharmacy would regulate them.
Yes. that's
Okay,
right.
thank you.
The motion is that we adopt the amendment. All in favor, say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it. And now Senator Blunt moves title sufficient do pass as amended. All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. Senator Turner Ford has been working on Kratom. Brings to mind Patsy Cline for some reason. But at this point, I'll call up House Bill 1077. I believe there's a strike all that's being distributed, and I would ask Senator Turner Ford to, I guess, move title sufficient to pass, move adoption of the amendment, and then you can speak to the amendment.
Thank you, Mr. Chairman. The amendment proposes to add a couple of provisions to House Bill 1077. And basically, Kratom would be, there are requirements that it be sold behind the counter. But what I would also request, in addition to not being sold to persons under age 21, but the amendment proposes to state that any Kratom product that does not have a label, the labeling must clearly reflect the identity, address, telephone number, and the full list of ingredients that will be sold in the product. And also that the product must be registered with the Department of Revenue prior to being made available for sale. That would be the proposed amendment. If I need to restate that, I will. I yield for questions.
Are there questions? Debate? Senator Turner Ford moves adoption of the amendment. All in favor, say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. And then the motion is title sufficient do pass as amended. All in favor, say aye. All opposed, no. The ayes appear to have it. The ayes have it. At this point, I will call up House Bill 1402 and entertain a motion, title sufficient to pass, and a motion that we adopt the amendment from the Appropriations Committee. In the earlier iteration of this, the Appropriations Committee, when we were doing the Senate bill, wanted to have more restrictive language about the use of the funds in this particular fund. They've got the underlying language on lines 32 and 33, which is just a bit more tightly drawn than the way the bill passed the Senate. So I would entertain a motion that we adopt the amendment that was sent to us by Appropriations. And all in favor of the amendment, say aye. Opposed, no. The ayes appear to have it. The ayes have it. Now the vote occurs on title sufficient do pass as amended on House Bill 1402. All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. At this point, I would go to House Bill 1062. Is there a motion just to get us procedurally where we need to be, title sufficient, do pass? And so there is such a motion, and then I would entertain a motion for a strike all amendment that brings forward the text of the House bill and adds a reverse repealer. Senator Blackwell moves that we do that, and I'd like to explain why. There are several issues involved in this legislation. One is to what extent dental hygienists should be able to practice in a dentist office with the dentist being absent for short periods of time. There also is a question about providing dental services for people in institutions, particularly in prisons and in nursing homes. And there are various thoughts about how to handle that. Time just ran out trying to juggle all of those things. And so my request to the committee is that we pass the strike all amendment with the reverse repealer, which will give us time to try to work through some rather technical areas in those fields. That's what the amendment does. That's my debate, questions. Motions to adopt the amendment. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. And now we have a motion, title sufficient, do pass as amended. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I think at this point, we have two bills pending, and I don't think we have the text of the bills before the committee. And so it may not be possible for us to get either of these before we go back in at 3:50. But if we could stand in recess subject to call, I think in about 45 seconds, I can have an update for the committee. So motion, title sufficient, recess, that word, recess subject to call. This is just like the secretary said. All in favor, aye. Opposed, no. Ayes have it. It'll be maybe a minute. We have copies that are out in the hall that should arrive very quickly. So it'll probably be another couple of minutes while we get those in here, and then we'll reconvene and go from there. Call the committee back to order. We'll be taking up House Bill 1123, which is the pharmacy benefit manager legislation. I will entertain a motion title sufficient to pass and a motion to adopt the amendment that's before you and proceed to explain the amendment that's before you and how we got here. You may remember when we were taking up Senate bills, we took up a Senate bill and we adopted a proposed amendment by Senator Parks. That bill went to the House. The House sent us their bill. Sometime after that, I got a call from the House that said a group of people were meeting to talk about this issue. And just as an aside, I think at this point, I'll just share with everybody what I think is the situation. Basically, states are struggling with what's a federal issue. The real remedy for all this is going to have to come from the federal government. We're doing the best we can in the meantime. But I believe it's the case that overwhelmingly people in this building want to help the independent pharmacist. We're struggling with figuring out how we can do that because actually there are there's things that we just can't do that would require federal legislation. We also don't want to inadvertently increase fees dramatically on insurance policy holders and others. So there's that. But a group of people convened by the House met and came with a proposal that was very similar to Senator Parks's amendment. They asked that we take up their bill. I'm happy to do that. After getting that text from the House, I shared the text with several groups, and there's some very minor changes in what's before you now as a result from that. I cannot tell you, in the words of Nolan Metatol, that everybody's on board. But I can tell you that everybody's as close to getting on board as I think we're going to get in this world. The bill is essentially Senator Parks's legislation with minor changes. If there are questions, I can get Senator Parks to explain what was in her amendment. And if there are questions, they're probably about substance, they may be directed better to Senator Parks than to I, but I'll entertain any questions if anyone has any. Senator Hobson.
Thank you, Mr. Chairman. I would like to know what they are. Senator Parks could explain what the difference is between this bill and the original bill that passed the Senate. I would be grateful. Thank you.
So the difference, what we agreed upon were, there were three things. One is that we would replace with the old original language that spoke to how the calculation was done. And what I mean by that is in the reference to Golden Standard and Metaspan versus NADAC. That's in section 157. We put that original language back in there. And then the other thing that they asked be removed totally were when we were talking about the coupon or the card from 7 days to, we were asking for that to be paid in 7 days versus 60 or 90. We redacted that as well. And it reverted back to the original language. So that is no longer there. That's two. And the third were, they wanted to make sure, we did have in the definitions, the healthcare plan that was completely defined, but they wanted that to be defined further into the bill, and we did that as well. So it was very minor changes, and we're very happy to agree upon those.
Further questions? Ready to vote? The motion is to adopt the amendment. All in favor say aye. All opposed, no. The ayes appear to have it. The motion recurs title sufficient do pass as amended on the House Bill 1123. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I will tell people this bill will now be reported out of this committee. The text of it will be on the website, and everyone literally will have a chance to read it. And if there are technical errors or problems, everyone will have a chance to point those out to us. This point, I'm going to call up House Bill 569 and ask for a motion, title sufficient, do pass, and then the motion that we adopt the strike all amendment. And I'd like to explain the amendment. It was my intention, it is my intention to take up House Bill 569 as a vehicle. There's some language from House Bill 922 that I would like to include in this bill, but I think I could explain that and we can go from there. The strike all that's before you is the language that the Senate passed and sent to the House. The change in what that did was it basically removed the prohibition against certain facilities participating in the Medicaid program, which may have been useful years ago, but I don't think it's useful anymore. It takes care of a particular situation in Harrison County involving participation in Medicaid. And it also provides for an additional 20 beds at Sun Valley. The strike all contains the following language. And where's the change about the UMMC? 16. That's in it. So what else is in 569? There's something added into that. But that's the Senate. Is there anything other than the Senate strike all? Okay. So what's before you in the proposed amendment is the Senate strike all. These are the changes that I was hoping which would get into the bill, but I can explain them, I believe. Right now, there is a limitation on machines and buildings based on dollar amounts that were enacted some time back. I think, again, is this 922? Okay. Okay, so here we go. The existing language says you are not required to get a certificate of need for a piece of major medical equipment that's less than 1.5 million. This would change that amount to 3. You're not required to get a certificate of need for a building used for clinical health services in excess of 5 million This would change that to 10. And if you're building something for non-clinical health services, then that would go from 10 million to 20. It's the thought of the Department of Health and the House, and I agree that these are circumstances where we feel the process of getting certificate of need is just not justified by the amount of the expenditure, and this doubles the existing amounts. The second thing that changes is a provision concerning the use of the medical exemption, so-called, by the University of Mississippi Medical Center. I believe I can't find where that is. The University of Mississippi Medical Center has had, and I think most people agree that it should have, an exemption for certificate of need for things that they do to actually teach students, more or less at the medical center itself. There's been some concern that that exemption is gotten rather broad. The House was going to just do away with that exemption, I think. What the bill before you does is to draw a rectangle around Interstate 55, Woodrow Wilson, Lakeland, and Bailey Avenue. And that's a rectangle that takes in the University of Mississippi Medical Center, what we think of as their campus, and it takes in the Jackson Medical Mall. And it specifically says that the exemption for facilities which are used for educational purposes in that area would not require a certificate of need. But if they're getting outside that area, they have to go through the same process that other hospitals do. I personally think that's a pretty good way to take care of the core functions of the medical center, with taking into concern some other people were having about some of their facilities that were being built elsewhere. There are several issues that I think have merit that I don't think we're in a position to deal with just now. And so what the bill that's before you would do, the proposed strike all, would direct the State Department of Health to study exempting from the certificate of need requirement dialysis units placed at small hospitals, primarily for the purpose of reducing the number of transfers of patients. This is a study. It does not grant any certificates of need. It does not propose to abolish certificates of need for dialysis. It just asks the State Department of Health to look at a peculiar situation, which is small hospitals have someone there who needs dialysis for a brief period of time. Because of dialysis, the need for dialysis, they're being transferred to other facilities, which is an inconvenience to the family. And so this is an opportunity to see if there is some remedy for that situation. The second involves geriatric psychiatric units, which is a service that is easier, for lack of a better word, to provide than dialysis, something that a number of small hospitals are using. And it asks them to study what would happen if we just did away with the requirement for the CON for geriatric psychiatric units at small hospitals. And then there's also a direction for them to study the situation with acute adult psychiatric units, where not all providers are seeing the same number of uninsured. It's a fairly extreme situation in that there are some providers who almost see no uninsured, and that sends the cost of uninsured up in other institutions. We had some years ago, what was referred to as sort of a pay or play thing, where if a hospital did not maintain a trauma center appropriate for a hospital of that size, they would be assessed a fee to help underwrite the cost of trauma centers at other hospitals. And so this just directs a study to see is there anything that can be done about that. So that's what the proposed strike all does. I think, said everything. And I'll be happy to answer questions. Senator Blunt.
Thank you, Mr. Chairman. I don't have a question, but I do have a technical amendment at the proper time.
Okay.
I'm reading the description of the UMC property in Jackson. And I believe the intent, as you described it, is to include essentially the medical center and where it is now and the medical mall and where it is now. The language in the bill, the western boundary of the language in the bill is Bailey Avenue. On lines 1229, 1235, and 1236. Bailey Avenue is on the east side of the medical mall. So I think to do what you want to do, we need to extend the western boundary one block to the west and make it Livingston Road and not Bailey Avenue, because if Bailey Avenue is the eastern boundary, the medical mall is not in it. So
Your motion's to strike Bailey Avenue and insert in lieu thereof
Livingston Road. Yes, sir.
Understand the amendment? Ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Further debate, discussion. Senator McMahon.
Mr. Chairman, this is a strike all and you've described a lot of changes and you're not going to take this up on the floor tomorrow. You're going to give it a little
I'm
time.
not going to take this up on the floor tomorrow.
Okay, thank you.
It's my intention to leave this particular bill on the floor at least for a couple of days to let everybody read it. And particular, I anticipate there may be some corrections or other changes, but yes, I intend to leave it on the floor for a couple of days.
Thank you.
Senator Phillingain.
Thank you, Mr. Chairman. I would like to offer an amendment at the appropriate time, please.
This is appropriate.
Thank you, Mr. Chairman. I would like to insert the teaching facilities at William Carey University, their medical school, as part of the exemption that you're also offering to the UMMC. Right, for their campus where the
And-
medical
and
school is
so-
located.
You're going to come up, should the amendment be adopted, you will come up with a definition for us, which takes into account the area around the medical school at William Carey.
Yes, Mr. Chairman, I will.
But it would not involve any other hospitals or anything else. It's just the geographical area where their medical school is on the William Carey campus.
Right, if you're talking about CON waivers or exemptions, I think that would be sufficient
For, again, for teaching purposes.
for teaching purposes.
You understand that amendment? You ready to vote? All in favor say aye.
Aye.
All opposed, no. Ayes appear to have it. The ayes have it. Further discussion? Debate? If not, the motion recurs on adoption of the strike all amendment. All in favor of that say aye. All opposed, no. The ayes appear to have it. The ayes have it. Then the motion would be title sufficient do pass on House Bill 569 as amended. All in favor say aye.
Aye.
All in favor, no. The ayes appear to have it. The ayes have it. I will now entertain a motion to rise and report. All in favor say aye. Opposed, no. The ayes have it.